Hi friends, I just wanted to give you a brief overview of these platelet disorders. Remember, these are all platelet disorders. Means that there's something wrong with the platelet, but there is nothing wrong with the coagulation factors. So those factors 1, 2, 7, 8, 9, 10, and so forth that are converting thrombin, and then from thrombin to fibrinogen to fibrin, they have nothing wrong with that. This is only platelet disorders. So let's make this easy for you. The first thing we're going to talk about is ITP. ITP stands for immune thrombocytopenia. So first thing to remember is that penia means less. You have less of something, penia. Thrombocytes are platelets. So these refers to platelets. So this refers to platelets right here. So this means platelets. Penia means less. Thrombocytes means platelet. And immune means, you already know what immune means. So this is platelets, less. So you have less of platelets due to some kind of immune problem. So let's talk about ITP. ITP, let's refer to a platelet right here. This is our platelet friend right here. Okay, this is the endothelial membrane that is being injured. So these are your endothelial cells that are being injured. This is your platelet. On one side of platelet, you have a receptor is G1B. This binds to the 1 Willebrand factor. The other side of the platelet has GB 1B3A. Okay, think of it as just like a receptor. And this, in healthy tissue, what happens is that this binds to fibrinogen, and then it connects with another platelets. And this is how the platelet gets aggregated. This is what happens in normal condition right here. Normal condition, this is what's happening. Now, if you have a problem with your platelets, such an immune response, what happens is that your body develops an antibody against G. We said this was GB 11B3A. So your body develops an antibody here. Sorry, this is a fat ass antibody, as you can see. So you have an antibody here. And then this eventually gets cleared by spleen. So this is why, what happens to your number of your platelets? Are they going to be normal or are they going to be less? Well, if your spleen is covering them because you have this, if your spleen is breaking down, is eventually going to take this and break this down, obviously you're going to have less, platelets. So decreased platelets, yes, less platelets. What about hemolytic anemia? Anything happening to the red blood cells? No. So no hemolytic anemia. Anything happening to the PPT or PT? Remember, these are coagulation factors. There's nothing about coagulation factors. These are all platelets. So that means that no, normal. PTT and PT is normal. Let's talk about TTP. So thrombotic thrombocytopenia. You already know thrombocytopenia means lack of platelets, less platelets. Thrombotic means something is making them very, very coagulative. So what is that thing in TTP? Well, what's happening is that we already talked about 1 Willebrand factor, right? If you don't break down 1 Willebrand factors further, what happens is that they really stay together and they attract lots of platelets, and eventually these platelets make a big thrombosis. Not good. So what eventually is happening is obviously they're going to use up all the platelets because these platelets are making this big clot. So are you going to have less platelets? Yes. Are you going to have anything with the hemolytic anemia? Yes, because remember that you're going to have schistocytes. Let's spell this correctly. Schistocytes. Because what happens is that as these red blood cells are passing through a big thrombus material, these red blood cells are eventually going to be, these are the little red blood cells, they're eventually going to be deformed. So that's why you get schistocytes. Or do you get an anemia? Yes. What happening to the PT or PTT? Well, you're still not doing anything to the coagulation factor, so they are going to be normal. Now let's talk about HUS, hemolytic uremic syndrome. Uremic means something related to the kidney, okay? Hemolytic should tells you, okay, we're lysing something, so immediately you know that are you going to have hemolytic anemia? Yes. Are you going to have a number of platelets? Yes, because remember that you are making this is a platelet disorder, so yes, you are going to have less platelets. Um, what's happening to the PT or P? Again, nothing to do with the coagulation factor. So is it going to be normal? Yes, it's going to be normal. How are you going to differentiate between TTP and HUS? They both have less platelets. They both have hemolytic anemia. They both have normal PTT. Remember that TTP is thrombotic thrombocytopenia, is affecting all the little blood vessels everywhere, including your brain. It's causing these thrombus in all these little blood vessels everywhere. So you're going to see CNS symptoms, so like confusions and so forth. You're also going to see fever because of the inflammation. Versus HUS, it's usually a kid, a child, due to E. coli. Remember that there's a toxin in E. coli that can cause hemolytic uremic syndrome. Basically, the toxin attracts the toxin basically attacks all the capillaries in the glomerulus in the kidney, and then eventually, as the red blood cells pass through, they get they get hemolyzed. So so it's usually child, and it's usually a GI illness like diarrhea and stuff. Okay, DIC, disseminated intervascular coagulation. So remember, disseminated means everything, everywhere. So are you going to have less platelets? Yes, less platelets. Let's see. Yes. Are you going to have hemolytic anemia? Yes. Are you going to have problems with the coagulation factors? Yes. D, remember, D means disseminated, everything. So hopefully this gives you some idea as to how you can go about taking care of this. I wish you all the best. Please leave a comment if you have any questions, and I hope to see you in the next video. Take care. All the best to you.